Chronic kidney disease, CKD, affects more than 1 in 7 U.S. adults. And approximately 2 in 1,000 Americans are living with end-stage kidney disease, ESKD, kidney failure that is treated with a kidney transplant or dialysis. Despite the prevalence of kidney disease in the United States, as many as 9 in 10 people who have CKD are not aware they have the disease. Early-stage kidney disease usually has no symptoms, and many people don't know they have CKD until it is very advanced. Kidney disease often gets worse over time and may lead to kidney failure and other health problems, such as stroke or heart attack. The kidneys are among the most vital organs in the human body, acting as sophisticated waste management systems. They filter out toxins, excess salts, and urea, a nitrogen-based waste created by cell metabolism. But our kidneys also maintain a healthy balance of electrolytes, control blood pressure, and stimulate the production of red blood cells. In short, we couldn't live without them. However, our kidneys are also sensitive and susceptible to various diseases, often as a result of our daily habits. Unfortunately, the damage caused by these habits can be silent, slowly impairing kidney function over the years without noticeable symptoms until the situation becomes critical. The key to avoiding serious kidney problems lies in prevention and early detection. By understanding the daily habits that pose a threat to our kidneys, we can make changes that can dramatically reduce the risk of kidney disease. In this video, we're going to discuss 10 daily habits that may be causing harm to your kidneys. We will take a close look at the causes and symptoms of the associated diseases, explore available treatments, and provide valuable advice for maintaining and improving kidney health. Your journey to better kidney health starts here, with understanding and action. Let's start with 10 daily habits that are destroying your kidneys. Stay tuned. 1. Excessive consumption of processed foods. Processed foods refer to any food that has been altered in some way from its natural state, either for safety reasons or for convenience. This includes foods that are canned, frozen, refrigerated, dehydrated, or have had their shelf life extended. Some examples include deli meats, canned vegetables and fruits, microwave meals, chips, and cookies. Causes. Processed foods are notoriously high in sodium and phosphorus. These two elements, when consumed in large amounts, can be difficult for the kidneys to filter out of the blood. Over time, this excessive strain can lead to kidney damage and potentially result in chronic kidney disease, CKD. High sodium intake is also linked to high blood pressure, another risk factor for CKD. Symptoms. Consuming high levels of processed foods may initially cause no noticeable symptoms, as kidney disease often develops silently over a long period of time. As kidney function decreases, symptoms may include increased thirst and urination, swelling in the hands and feet due to fluid retention, edema, high blood pressure, fatigue, and loss of appetite. Treatment. If diagnosed with kidney disease, treatment might involve dietary changes to lower sodium and phosphorus intake. This could mean limiting or avoiding processed foods, fast foods, and certain dairy products, which can be high in these minerals. Medication might also be needed to manage high blood pressure or to help the kidneys remove excess phosphorus. Health improvement advice. To protect kidney health, it's advised to limit the consumption of processed foods. Instead, focus on eating fresh, whole foods that are low in sodium and phosphorus. This might include fresh fruits and vegetables, lean meats, whole grains, and low-sodium dairy products. Cooking meals at home allows for better control of what's going into your food, providing a healthier alternative to pre-packaged meals and snacks. 2. Insufficient water intake. Staying adequately hydrated is essential for overall health, and particularly for optimal kidney function. Water helps the kidneys remove wastes from your blood in the form of urine and helps keep your blood vessels open so that blood can travel freely to your kidneys, providing essential nutrients. Causes. If you're not drinking enough water, your body can become dehydrated. Dehydration can cause the urine to become concentrated, which can lead to the formation of kidney stones and even contribute to the development of chronic kidney disease. The risk is particularly high in warm climates or for people who are active and lose more water through perspiration. Symptoms. Symptoms of mild to moderate dehydration can include dry mouth, thirst, fatigue, dizziness, less frequent urination, and dark-colored urine. Severe dehydration, which is a medical emergency, may cause extreme thirst, very dry mouth, lack of sweating, sunken eyes, shriveled and dry skin, low blood pressure, rapid heartbeat, fever, and delirium. Treatment. Treatment for dehydration involves replenishing the body's water supply, either by drinking more fluids or, in severe cases, receiving intravenous fluids. In the case of kidney stones, treatment may include drinking a lot of water and taking medication to break the stones down. Health improvement advice. To prevent dehydration, ensure you're drinking enough water each day. The standard recommendation is about 8 glasses, 64 ounces, a day, but this can vary depending on factors like your size, activity level, and climate. Foods with high water content, such as fruits and vegetables, can also contribute to your overall hydration. 3. Frequent use of over-the-counter painkillers. Over-the-counter, OTC, painkillers, such as nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and acetaminophen, are commonly used to manage pain, inflammation, and fever. While these medications are safe for occasional use, frequent or long-term use can have harmful effects on the kidneys. Causes. Frequent and prolonged use of NSAIDs can reduce blood flow to the kidneys, leading to kidney injury and interstitial nephritis, and inflammation of the kidneys. In severe cases, this could progress to chronic kidney disease or even kidney failure. Additionally, people who already have kidney disease may further harm their kidneys if they regularly use NSAIDs. Symptoms. Kidney damage due to NSAIDs may not produce obvious symptoms until significant damage has occurred. Symptoms of advanced kidney problems include reduced amount of urine, swelling of your legs, ankles, and feet from retention of fluids caused by the failure of your kidneys to eliminate water waste, unexplained shortness of breath, excessive drowsiness or fatigue, persistent nausea, and chest pain or pressure. Treatment. The first step in treating NSAID-induced kidney damage is to stop using these drugs. Depending on the extent of the damage, you may also require medication to control high blood pressure, high cholesterol, anemia, and swelling. In severe cases, dialysis or a kidney transplant may be necessary. Health improvement advice. If you frequently use NSAIDs, consider speaking with your doctor about safer pain management strategies. Alternatives may include other types of pain relievers, physical therapy, and certain lifestyle modifications, such as exercise and stress management techniques. Always use over-the-counter painkillers as directed and avoid using them for more than 10 days without consulting a healthcare professional. 4. Excessive alcohol consumption. While moderate alcohol consumption is usually considered safe, excessive drinking can have significant negative effects on various aspects of health, including kidney function. Causes. Alcohol is a toxin that places significant stress on the kidneys and liver. When consumed excessively, it can cause direct damage to kidney cells, potentially leading to alcoholic kidney disease or increasing the risk of chronic kidney disease. Additionally, alcohol consumption can lead to high blood pressure, a leading cause of kidney disease. Symptoms. Symptoms of kidney damage due to excessive alcohol consumption are often not noticeable until the damage is severe. They can include fatigue, feeling unwell, reduced appetite, itchiness, swelling in the hands or feet, shortness of breath, or more subtle signs such as increased or decreased urine output, foamy urine, or blood in the urine. Treatment. If kidney damage has been caused by excessive alcohol consumption, the first step in treatment will be to stop drinking alcohol or significantly reduce intake. Depending on the extent of the damage, other treatments may include medication to manage symptoms or complications, dietary changes, or in severe cases, dialysis or a kidney transplant. Health improvement advice. If you drink alcohol, do so in moderation. This typically means up to 1 drink a day for women and up to 2 drinks a day for men. Consider having several alcohol-free days each week. If you're struggling to reduce your alcohol consumption, don't hesitate to seek help from a healthcare professional. They can provide guidance and resources to help manage alcohol use and maintain kidney health. 5. Smoking. Smoking is one of the leading causes of numerous diseases, including heart disease, lung cancer, and chronic respiratory disease. Moreover, it is also a significant risk factor for kidney disease. Causes. Smoking damages the body's blood vessels, leading to slower blood flow throughout the body and to the kidneys. Over time, this can impair the kidney's ability to function properly. Smoking also increases blood pressure and heart rate, reduces blood flow, and narrows blood vessels in the kidneys. Additionally, smoking can aggravate existing conditions, such as diabetes and high blood pressure, that cause kidney problems. Symptoms. Similar to other habits that harm the kidneys, smoking may not present symptoms until severe kidney damage has occurred. These can include foamy or bloody urine, high blood pressure, more frequent urination, particularly at night, puffy ankles, feet or hands, due to water retention, and fatigue. Treatment. The most important step in treating kidney damage due to smoking is to quit smoking. Depending on the severity of the kidney damage, further treatments may include medications to control high blood pressure, dietary changes, dialysis, or in severe cases, kidney transplantation. Health improvement advice. If you're a smoker, the best thing you can do for your kidneys and overall health is to quit. There are numerous resources and programs available to help you quit smoking, including nicotine replacement therapies, medications, counseling, and support groups. Your healthcare provider can provide guidance and help create a quit plan that's right for you. 6. High sugar consumption. High sugar consumption, particularly in the form of sugary drinks and processed foods, can have a significant impact on overall health and specifically on kidney health. Causes. Consuming too much sugar can lead to obesity and diabetes, both of which are risk factors for kidney disease. Sugar can also cause high blood pressure, another risk factor for kidney damage. Furthermore, excess sugar in the urine can increase the risk of developing kidney stones. Symptoms. Early stages of kidney disease may not present any symptoms. As the disease progresses, symptoms may include frequent urination, especially at night, fatigue, itchy skin, muscle cramping, nausea, and puffiness around the eyes. Treatment. If kidney damage has occurred due to high sugar consumption, treatments may include lifestyle changes such as reducing sugar intake and adopting a healthier diet. If diabetes or high blood pressure is present, medication may be necessary to manage these conditions. Health improvement advice. To prevent kidney damage, try to limit your intake of sugar, particularly from sugary drinks and processed foods. Opt for water, unsweetened tea, or other unsweetened beverages instead of sugary drinks. Choose fresh fruit for dessert instead of sugary snacks. Also, try to incorporate more whole and unprocessed foods into your diet. 7. Sedentary lifestyle. A sedentary lifestyle, characterized by prolonged periods of physical inactivity or sitting, can have numerous detrimental effects on health, including kidney health. Causes. Leading a sedentary lifestyle can contribute to the development of high blood pressure, cardiovascular disease, and type 2 diabetes, all of which are risk factors for chronic kidney disease. Inactivity can also lead to obesity, another key risk factor for kidney disease. Symptoms. Symptoms related to kidney damage due to a sedentary lifestyle may not appear until significant kidney damage has occurred. These can include fatigue, swelling in your hands or ankles, shortness of breath, increased or decreased urination, or foamy or bloody urine. Treatment. Lifestyle modifications, including regular exercise and a healthy diet, are the main treatments for kidney damage caused by a sedentary lifestyle. If other conditions such as high blood pressure or diabetes are present, medications may be necessary. Health improvement advice. To prevent kidney damage, aim for at least 150 minutes of moderate intensity physical activity per week, such as walking, cycling, or swimming. Regular physical activity can help control blood pressure and weight, both of which are important for kidney health. Break up long periods of sitting by standing, stretching, or taking short walks every hour or so. If you have been inactive for a while, it's best to start slowly and gradually increase the intensity and duration of your activities. 8. High blood pressure. High blood pressure, also known as hypertension, is a common condition where the force of the blood against the artery walls is too high. Persistent high blood pressure can damage various organs in the body, including the kidneys. Causes. High blood pressure can damage the blood vessels in and leading to your kidneys, causing them to weaken, narrow, or harden. These damaged blood vessels prevent the kidneys from effectively filtering blood, leading to harmful accumulation of wastes and fluid in the body. This can further raise blood pressure, creating a dangerous cycle. Symptoms. High blood pressure is often known as a silent killer because it rarely causes symptoms until it has done significant damage. In the context of kidney damage, symptoms might include changes in urination patterns, foamy or bloody urine, fatigue, swelling in the hands, ankles, or feet, and frequent headaches. Treatment. Treatment for high blood pressure often includes lifestyle modifications such as adopting a healthy diet, getting regular exercise, limiting alcohol, and quitting smoking. In addition, several types of medication can help lower blood pressure. If kidney damage has occurred, treatments may include medications to control blood pressure and cholesterol levels, changes in diet, and in severe cases, dialysis or a kidney transplant. Health improvement advice. Regular monitoring of your blood pressure is important to prevent kidney damage. Aim for a blood pressure of less than 120/80ths of a millimeter Hg. Regular physical activity, a diet rich in fruits, vegetables, and low-fat dairy products, and limiting salt intake can all help control high blood pressure. If you have been diagnosed with high blood pressure, follow your healthcare provider's advice carefully to manage the condition. 9. Ignoring common infections. Ignoring or not properly treating common infections can sometimes lead to serious complications, including kidney damage. Causes. When the body fights off an infection, it produces an inflammatory response. This response, if ongoing due to a chronic or untreated infection, can lead to kidney damage. Certain bacterial infections, like recurrent urinary tract infections or pyelonephritis, can directly affect the kidneys and lead to kidney scarring or more serious kidney disease. Symptoms. Symptoms will vary depending on the specific infection. For urinary tract infections, symptoms might include a frequent urge to urinate, burning sensation during urination, cloudy or strong-smelling urine, and lower abdominal pain. If a kidney infection develops, symptoms might include back or side pain, fever, and nausea or vomiting. Treatment. Treatment of infections usually involves antibiotics or antiviral medications, depending on the type of infection. Drinking plenty of fluids can also help flush out bacteria. If an infection has caused kidney damage, additional treatment may be required, such as medications, dialysis, or potentially a kidney transplant in severe cases. Health improvement advice. Don't ignore common infections and seek treatment promptly. If you have symptoms of an infection, such as fever, pain, changes in urination, or unexplained fatigue, it's important to seek medical attention. If you're prone to urinary tract infections, consider preventative measures like staying well hydrated, urinating regularly, and not holding in urine for long periods. 10. Insufficient sleep. Good sleep is important for overall health, and chronic sleep deprivation can have serious consequences, including potential damage to the kidneys. Causes. Sleep is vital for the body's ability to heal and repair blood vessels. When you don't get enough sleep, your body can't properly carry out these functions, potentially leading to damage, including to the kidneys. Furthermore, sleep deprivation has been linked to many health problems, including heart disease, diabetes, and obesity, which are risk factors for kidney disease. Symptoms. Symptoms of chronic sleep deprivation include fatigue, difficulty concentrating, mood changes, and a weakened immune system. In terms of kidney health, insufficient sleep may not present specific symptoms until significant kidney damage has occurred. These symptoms can include fatigue, reduced urine output, swelling in the hands or ankles, shortness of breath, and high blood pressure. Treatment. Improving sleep hygiene is the main treatment for health issues related to insufficient sleep. This might include maintaining a regular sleep schedule, creating a comfortable sleep environment, and limiting caffeine and electronic devices before bedtime. If kidney damage has occurred due to chronic sleep deprivation, treatments may include medications, dietary changes, dialysis, or in severe cases, kidney transplantation. Health improvement advice. Aim to get 7 to 9 hours of sleep per night. Try to maintain a regular sleep schedule, going to bed and waking up at the same time each day. Make your sleep environment comfortable and free from distractions. Regular exercise and a healthy diet can also promote good sleep. If you're having persistent problems with sleep, don't hesitate to discuss them with your healthcare provider. Thank you for tuning in to today's video on 10 daily habits that are destroying your kidneys. If you found this information valuable, don't forget to hit the like button and share it with your friends and family. Also, don't forget to watch the 16 foods that naturally detox and cleanse your kidneys video we uploaded last time. Remember, prevention is always better than cure, so let's take charge of our health and make positive changes starting today. If you have any questions or suggestions for future topics, leave them in the comments section below. And as always, stay healthy, stay happy.
Thank you for watching. Please subscribe to our channel and share, like, and tell other people about this video. See you next time.